Good evening, everyone. Thank you so much for joining us. We're just going to give it a couple minutes while everybody gets logged on, and then we will begin. I see folks are joining, so that's great. Okay, maybe we'll slowly get started. We'll start by, I want to thank everybody for attending tonight. We're very happy and excited to be at the point where we get to talk about the actual onboarding of the home care and community group staff onto the HEB benefit and pension plan. We know it's been a long time coming, and thanks to a lot of hard work by the local presidents and activists to get us here today, we're going to be able to, the employer is going to be walking through a presentation about how you're going to be able to onboard, how you register, answer some questions, and then, sorry, something just flashed across my screen there, my apologies. So, as we do this, as I said, we're going to start with some opening comments from CUPE, from a few of the presidents and our regional director, and then we're going to go into a presentation by the employer, and then we will be doing some questions and answers at the end. During the presentation, however, you will be able to ask your questions. On the screen in front of you, there should be a box where it's a question. Click on that, you can type in your question, and our screeners here behind the scenes will be able to see those questions. And at the end of the employer's presentation, we will go through and answer as many of those questions as we can. We won't be answering individual or personal questions about someone's individual circumstances. Those, if you have those questions, you can either contact your local president or your national representative, or you can email to healthcare, all one word, at cupe.ca. Again, it's healthcare@cupe.ca, and we'll be able to respond to those questions. There's a few of us here tonight that you won't see on camera, but they're helping us out, and they're the national representatives for CUPE. We have Rick McAlpine from the north, George Bouchard from the south. We have Alex McClurg and Bob Morose from Winnipeg. And so they're going to be helping us in the background. And then, all right, I think we're good now. I think we'll get started. So we will, I'm going to turn it over one by one, and I'll let the presidents, as they come on, introduce themselves. So I'll start with Margaret.
Hello, everybody. Thank you for joining us. I'm Margaret Schroeder, president of CUPE Local 204, and on this call we would have our home care workers and mental health proctors from the WRHA. Thank you all for joining us. We're really pleased to, at this point of transition to HEP benefits and pension plan for some home care and community members. We know it's been a long time coming. You put our trust in CUPE during the representation votes, and we have delivered on our promises. We have provided increased wages, coffee breaks, removal of the AWP, sick time, and now the benefits and pension. I'm really proud to be representing this group of workers. You're passionate, dedicated members of our healthcare team. You're never afraid to demand better treatment, and you do fight for your rights. So thank you all. Shannon?
Sorry, thank you, Margaret. I'm going to go to Christine now.
Hey there, Christine Gulliford, President CUPE Local 8600. So first of all, thank you to my Northern home care workers for tuning in to get your questions answered. This webinar is an important part of making sure that you all understand what's going to be happening over the next few weeks, so I don't want to take up too much of your time. CUPE is here to support you during the transition, but the employer and HEB are actually doing the work of getting your benefits and pension in place and making the technical side of the transition happen. So I'm looking forward to that presentation. I have to say, in 2 rounds of bargaining, we have added so much, and I'm really excited to get the final piece in place so home care members can feel the respect we know they deserve. Thanks. Shannon?
Thanks, Christine. Holly.
There, trying to figure out all these technical buttons here, so finally got on this time. Yeah, thanks, Shannon, for for bringing me on here. I just want to echo everything that everybody else has said. We have been working very hard for our home care workers, especially our last two bargaining rounds that we've had. Things like not long ago, 6 years ago, about give or take, we've had members that couldn't even afford gas to get to work and put that in their vehicle and to go to their clients and back and forth to where they're going, let alone the depreciation that they would get on their vehicles from going onto gravel roads and things like that as well. So we are happy that we now have the top of class mileage rates with our CRA rates for our home care workers. And it wasn't long ago, 10 years ago, it seems like it was forever ago, but it wasn't that long ago. If you were sick, you were out of money, you weren't getting your paid days. We now have fully paid days. So if you call in sick and you have income protection in your bank, you are now covered for those full shifts. Another great way that we have helped our home care workers. And I could go on, of course, but anyway, thanks for being here, everybody from the South. And we're looking forward to connecting with all folks during this Q&A. Thanks, Shannon.
Thanks, Holly. So one more speaker before we get to the employer presentation. So Lee.
Hi, good evening, everyone. Lee McLeod, I'm the Regional Director for CUPE here in Manitoba, and I'm very happy to be with you here this evening. This is a historic time that we've waited for a long time, that all of you have waited for. And one of the things that happened in the healthcare restructuring in 2019 is we talked openly at CUPE about maybe this was finally an opportunity to bring home care workers and community workers fully to the healthcare table. And we believe and we know that we could do that. We were hopeful about that. And now here we are. And it's well deserved by home care and community workers. We're very proud of this accomplishment that's been achieved by your bargaining teams, by your elected officials, by your local leadership. And they've done a tremendous job. And we're very happy to see all of you finally fully at the healthcare table where you deserve to be, and having the same benefits, the same provisions, the same pension. And this has just been a tremendous accomplishment. It's a great time. It's been a long time coming, but I have to congratulate all the staff and elected leadership. They've done an excellent job. And this is indeed a great victory and a very happy occasion for home care workers, community workers, and we're very proud of the work that's been done at CUPE, and we're very proud to be here tonight for all of you to hear the details of these changes and what it's going to mean for you, and the support and recognition that you deserve. So congratulations to all of you. You deserve this, and it's a long time in coming, but it's here now, and it's been a great work of your elected leadership and the team here, and very proud, and thanks for having me here this evening.
Thanks so much, Lee. Okay, so for folks who may have joined a little bit later, we're going to turn it over to the employer to do a presentation shortly. But before we do that, you can ask a question. There's a tab on your screen. If you click on that, you'll be able to type your question in, and won't be answering the questions until the end of the presentation, but we'll see them as they come in. So I will turn it over now to Anna, and she'll introduce herself.
Great. Thank you, Shannon. Thank you all for taking the time to join us this evening. My name is Anna Placido. I am the Interim Executive Director for Provincial HR Shared Services with Shared Health. And I too am going to echo the comments that have been shared here earlier. And we are excited to embark on this chapter and to be able to offer you all the HEB Manitoba benefit plans. This project has taken some time to plan and prepare for. We're here now, and we're excited to get everyone registered and enrolled so that you could start to enjoy the benefits of the plan. We're going to spend some time with this presentation and share all the important information with you that will help you understand the steps that you need to take to successfully register for the HEB Manitoba portal, complete the electronic enrollment, and understand the plans that are being offered to you. So I am going to pass it on to Mignon Marqueta, and she's going to get started, and she's going to deliver the presentation. Thank you.
Thank you, Anna. So, hi everyone, I'm Minyo, and like Anna said, I'm presenting on behalf of Provincial HR Shared Services and the employer. So I'm just going to share my screen here with you. 1 second. So I'll be walking you through your new benefits and what you need to know. So 1 second here. One moment. Is it going? Okay, give me 1 sec here. Let's try this one more time. Okay, we've just got to restart my presentation here. Sorry, we're just having, gotta open a presentation here. Sorry, yes, we're just having to reopen.
Sorry, folks, we're just having a little bit of technical difficulties there. JP, Mignon is saying her screen is completely blank.
It's back up. We're up
Okay.
again.
Okay, never mind. We're good.
Just restarting it. Sorry about that. Okay. Let's try this again. Okay. Okay, let me know if you could see this. Anna, we may not need to share your, if you've got the, it's not coming up for me.
It looks great. It looks good. Everyone can see it.
Okay, are we in business? Can we see some of my screen here?
We're in business.
Yes. Okay, perfect. Thank you. Sorry about that. So as the employer during this transition, we're working with the union and PHRSS, sharing communications as they become available. Employers are also going to be reporting employment changes for staff, such as leaves of absences, status changes, and transfers. And the employer is also ensuring that there is access to computers to complete HEB's registration and enrollment at selected locations across the province. So as you've likely seen already, communications regarding your benefits are being sent via email. So it is important that you check your spam or junk mail folders if you have an email. So these are the topics that we'll be covering today in our employer presentation to get you acquainted with HEB Manitoba's benefits as well as how-tos. So what can you expect as part of this transition? For eligible active employees, they can enroll in HEB Manitoba's benefit plans starting on September 16th. Active full-time and part-time employees are eligible for HEB Manitoba pension, the disability and rehabilitation, life insurance, healthcare, and the dental plans, which will be effective on October 1st. For casual employees would only be eligible for the pension plan, and that would be effective October 1st as well. So to prepare for this transition, employees are expected to register in HEB Manitoba's secure member portal. So we'll go over that in a little bit more detail in just a second. And you'll also be required to complete your enrollment between the period of September 16 to September 30th. So what about employees who are currently on a leave of absence? Anyone who is currently on a leave of absence, they will only be expected to enroll in HEB Manitoba's plans upon their return from leave to regular hours and full duties. So those on a leave can still register for the member portal, but they won't be expected to enroll until they come back, return to work. So as soon as the return from leave is transacted in our payroll system, this change is going to flow to HEB Manitoba, and then an email will be sent from HEB Manitoba system to let you know that there's an action waiting for you in the member portal. So this is why we emphasize that it's important that you register for this member portal so you don't miss any important communications when you return from your leave. As part of the registration, there will be a step that asks for your email address. So you'll want to be sure to provide your personal email address in that step, and then add HEB Manitoba as to your safe sender list to make sure that you are also receiving the emails that they're sending. So let's take a look at this transition timeline. And you've seen this already in some communications you received from HEB via the union. And this chart shows the key dates as part of this transition. As I mentioned, starting right now, you can go and register for HEB Manitoba's secure member portal. Okay, the enrollment period will start, pre-enrollment period opens up on September 16th and will close on September 30th. And then coverage will be effective on October 1st into HEB Manitoba's plans, which means your old plans with Canada Life and Element will end on September 30th. In October, that's also when you'll start noticing the payroll deductions for your new plans. And then finally, the enrollment period deadline will close on November 30th. So again, we'll revisit the transition timeline with respect to when to register, when you can do your onboarding, and what deductions are going to come off if you complete your onboarding on time versus if you complete them late. So what is included in your new benefits? So like you've heard, okay, moving to these HEB Manitoba plans is going to give you a range of new and improved employee benefits, including extended health, a long-term disability, as well as defined benefit pension plan and more. We recommend and we highly encourage you to visit HEB Manitoba's website to view the plan brochures. So for detailed information on the plans, you would have also received the benefits comparison document in the communication you got as well that provides an introduction to these benefits and what is changing from your current plan to your new plan. So here you'll see a summary chart of your new HEB Manitoba benefit plans. Let's take a look at what these are and what the premiums and contributions are for each of them. So first and foremost, the pension plan. This is a defined benefit pension plan, and the employee and employer will each contribute a percentage of their pensionable earnings up to the yearly maximum pensionable earnings, the YMPE. And then in excess of the YMPE, that percentage will increase, so the employee and employer share. For the disability and rehabilitation plan, so this is what we call the DNR. This is your long-term disability benefits, and these are entirely or fully employer paid. For life insurance, there is basic life insurance, which is fully employer paid. So that's 1 times your annual earnings. And you also will have the option to select optional personal or family units up to a maximum number of units. And there is a cost to you as the employee per unit that you elect, okay? And the cost that you pay will be paid every 2 weeks, so bi-weekly. For the healthcare and dental plan, the costs for these 2 plans are shared by the employee and the employer. You'll see on your screen there on the right column, the far right, the rates depending on the coverage you elect. So there's single coverage rate and family coverage rate for both healthcare and dental, and that will depend on when you enroll based on your true family status. So family coverage being that you have at least 1 or more dependents, which could be a common law partner, spouse, or children. Okay, some examples of what is covered in the healthcare plan. You'll see their services, paramedical practitioners such as chiropractor, physiotherapists, or occupational therapists, just as some examples, up to a certain maximum per calendar year per person covered in your plan, your dependents. There's also prescription drugs included, as well as vision care. So again, the details of the eligible expenses, the maximums for each of these services are covered in the plan brochures on HEB Manitoba's website. And then for dental plan, you'll notice there the maximum amount per person per calendar year, 100% of basic services for dental services, 50% of major, as well as some orthodontics. So again, details in the plan brochures, you can find all of that listed in there. You'll notice that employee assistance plan is not listed in the chart as you are already covered under this plan. So that for all of you will stay the same. Employees who enroll into HEB Manitoba's healthcare plan will also have access to the healthcare spending account, or HSA, provided they have at least 1 year of service. This HSA account can be used to cover eligible healthcare and dental expenses in excess of your existing benefit maximums. So the eligibility for the HSA is determined by and fully funded by your employer. The HSA benefit amount is $1,250 for full-time and $1,000 for part-time CUPE employees per year. If you pre-enroll into your healthcare plan, Manitoba Blue Cross will create your account, your HSA account, on October 1st, and you can start using this account shortly thereafter. However, if you register later, this will cause delays in accessing all of your coverage and benefits. So again, another reason to take advantage of the pre-enrollment period. So now that you have an idea of what benefits are going to be provided to you under HEB Manitoba, we'll walk through what you need to do in order to get set up in HEB Manitoba's system. So first and foremost is the registration piece. What you need to do is register for HEB Manitoba's secure member portal as soon as possible. So you can do this right away. You don't have to wait for the enrollment period to begin. And why you should register is that before you can enroll, you need to have an account set up, and the personal information you provide as part of registering confirms your identity as an eligible employee for HEB's plans. So today, like I said, all employees currently have an employee assistance plan that's provided through by HEB through Manitoba Blue Cross. So most employees may already have completed registration through the portal. And if you have not, it is important that you do this as soon as possible. So here you can see, this is just an example of what HEB Manitoba's homepage currently looks like. So on hebmanitoba.ca, this is where you're going to go to access the registration page. So on the top right-hand corner, there's a link called Member Login. You'll click that link, and then you'll open up to another window, okay, where you'll see the other screenshot there where it says Register Here, and then that will kick off the process for the registration. So this is what's going to look like when you click Register Here, okay, to that portal. In order to complete the registration, you're just going to follow the prompts that you see on your screen, and you'll be asked to create a username, create a password, and then set up security questions. So very quick and easy, maybe 2 minutes tops. We'll talk about supports, but something that you can do right away. Reach out to a family member or a friend, right? If you need help with doing this, and get this done as soon as possible, okay? So in order to ensure you register successfully, you will need certain information on hand, such as your social insurance number, your date of birth, and your postal code information. And again, like I said, that personal information you enter must match what HEB currently has on file. So if you're finding that your registration is not working, okay, this could mean that information that you're entering is not matching what HEB Manitoba has on file for you, such as your date of birth, your address, even the spelling of your name, for example. So we ask that if you are experiencing any registration errors, that you first contact Provincial HR Shared Services, your office, to confirm your data is correct first with your employer. And then once you have confirmed your data is correct with your employer, you will need to follow up directly with HEB Manitoba in order to report and resolve any discrepancy. Okay, one thing to note is that if your birth year needs updating in HEB system, then you will be required to provide proof of your age. So documentation, valid documentation to HEB Manitoba. So an example would be your birth certificate, a Canadian passport, for example. So that would be acceptable valid documentation to provide for proof of your birth year. And again, this is only if your registration is not working, okay? Could be a data mismatch between HEB system and your employer. So for more information on how to do the registration piece, you can go again to HEB Manitoba's website, and there is a unique home care transition page that I'll be speaking to and show you at the end of the presentation as well. Okay, so what about enrollment? So once you have completed your registration, which is the first thing you need to do, and as soon as possible, like I said, the enrollment period will open starting on September 16th. Okay, and so you'll log into your portal and you'll begin enrolling into your benefit plans. We do ask that you take advantage of the pre-enrollment period between September 16th to September 30th to avoid over or underpaying your premiums. Okay, and by enrolling in the member portal, this is going to allow you to manage and maintain your personal information, report life events, so changes to your family status, for example, and request coverage changes. And HEB Manitoba will also use the portal to communicate with you. So really important to get yourself set up in there. In order to successfully onboard, like I said, there's certain information you should have readily available to you and on hand in order to do your enrollment in the portal. So things such as birth dates for you, your common law partner or your spouse, as well as your dependent children, a date of marriage or cohabitation, as well as any plan numbers or coverage start dates for alternate group plans if you wish to waive coverage in HEB Manitoba's healthcare and or dental plans. Okay, so before you're going to do this, make sure that you have read the plan brochures and that you understand what options you have. So when you're going to go in to do your enrollment, okay, this is the screen that you'll see. So how you're going to enroll on your dashboard, you're going to see a pending enrollment tile. It's yellow, it'll be yellow. And when you click that, it will take you through an enrollment wizard, we call it, and that's going to walk you through everything you need to do to complete your enrollment. Through that enrollment wizard, we call it, it's going to ask you to confirm or add information about your dependents, okay, spouse, common law partner. And then when you're finished with that, it's going to move you through each of the plans that you're eligible for. So that enrollment pending tile will show on your dashboard until all of your enrollments are completed or until the final deadline of November 30th passes. So again, I keep mentioning this pre-enrollment period between September 16th and September 30th. The advantages of pre-enrolling by September 30th are that your deductions will be based on your true enrollments into the plans. If you enroll after September 30th, you will be enrolled into the default options and could be deducted more premiums than you actually require. Okay, enrolling early can also make sure that you and your eligible family members are receiving on-time access to your new healthcare, dental, and healthcare spending accounts. Your Manitoba Blue Cross card will also be mailed to you by the week of October 6th if you register and enroll prior to September 30th. Another advantage of pre-enrollment by September 30th is there's less chance of over or underpaying premiums or contributions as well. So if you wait to enroll, what's going to happen is you're going to be deducted the family level of coverage for the healthcare and dental plan until you complete your enrollment. And if you don't complete it by the final deadline of November 30th, then restrictions at that point will apply. And we'll talk a little bit more about what some examples are of the restrictions if you don't complete enrollment by that deadline. Also, if you wait to enroll in the pension plan, you will have to pay any missed contributions for both October and November on your next payroll following your enrollment. So enrolling early helps make sure that the deduction amounts are level. You will also have the opportunity for an earlier start to the commuted value transfer process if you want to use your home care defined contribution pension funds to purchase credited service in HEB Manitoba's pension plan. And finally, during the pre-enrollment period, you're also going to have access to additional resources will be made available to you in order to answer your questions and help you with the enrollment process. Okay, so I talked about what happens with late or no enrollments. If you do not complete your enrollment by the September 30th pre-enrollment period, you will be deducted the premiums for the default options in all of the plans for the first 60 days. So example of this is the default for that first 60 days for health and dental is the family level of coverage, okay, which we had seen is a higher cost than the single level. And then after the 60-day period, if you don't enroll, you're going to be enrolled in the default level for all plans and restrictions will apply. So after that 60-day period, then that default becomes a single level of coverage for health and dental and only the basic unit of life insurance. So for answers to the most frequently asked questions regarding HEB's plans and the transition to their plans, you can review the FAQs that were mentioned on HEB's home care transition page. We'll just go over a few common questions in these next slides here. So what if I already have coverage under HEB Manitoba or another group healthcare and or dental plan? If you have existing coverage under HEB or another group plan, you may enroll in HEB's plan and coordinate benefits with your other plan. Or you may choose to waive coverage in HEB Manitoba's plans. Whichever you choose, it is important to review the coverage that is being covered under each plan very carefully before you make that decision, because your choice to waive or enroll must be made before the enrollment deadline, and then you cannot change it later. So what I'm talking about is if you choose to waive coverage now, you are not eligible to enroll in HEB's plans until you lose coverage under that alternate plan. And then at that point, you will have to enroll within 60 days of losing that alternate coverage. On the other end of this, if you enroll now and coordinate benefits with your other group plan, you cannot waive at a later time. Am I eligible for HEB Manitoba's healthcare spending account? Your employer will advise HEB Manitoba if you are eligible for the HSA as of October 1st. If you are not eligible as of October 1st, it will be effective the first day of the month following 1 year of employment in an eligible position. When is my healthcare spending account effective? So if you are eligible, it will be available, the HSA, to you on October 1st, as long as you are enrolled in the healthcare plan. And the effective date for your HSA account will be January 1st, 2025. If you are changing coverage after enrollment and want to add family members later, okay, you must notify HEB Manitoba within 60 calendar days of any change in your eligible family members, and failure to do so could result in restrictions to their coverage. So you can report things such as a marriage, new common law relationship, and the addition of dependent children as what they call life events in your secure member portal. How do I submit a healthcare or dental claim to Manitoba Blue Cross? So Manitoba Blue Cross is the insurer for Manitoba's healthcare, dental, and EAP plans. So once you have received your Manitoba Blue Cross coverage card, you can submit your claims directly to Blue Cross by logging into the secure account on their website. The website you see there on your screen. You can download their app as well or visit a Winnipeg office. So again, if you take advantage of the pre-enrollment period and enroll by September 30th, your Blue Cross card with your contract numbers will be sent to you the week of October 6th. Regarding pension transfer, can I use my home care defined contribution pension funds to purchase service in the HEB Manitoba pension plan? Yes, if you are eligible, you may use the commuted value of your home care defined contribution pension funds to purchase service in HEB Manitoba plan. This is called a commuted value transfer. To be eligible for a transfer, you must enroll in the plan by the November 30th deadline and start making contributions to your HEB pension plan as of October 1st. So there are details of this process covered in the FAQ that, again, we recommend that you review if in order to answer your questions. Okay. So let's take a look at the deductions now that will be coming off beginning on October 1st. So just to summarize, DNR and basic life insurance is going to be deducted from every pay starting in your first pay in October. Optional personal or personal life insurance, these premiums are deducted from you. So those are employee paid on every pay as well. And for your healthcare and dental plans, the premiums will be taken from both you and your employer. So the share for both of you on a monthly basis. For the healthcare and dental premiums for October coverage, this is going to be deducted on your first pay in October, and you'll actually see two deductions in October, which will cover your October, the month of October as well as November. And then starting in November, the regular employer deduction schedule will be followed, and there will be only one healthcare and dental plan deduction every month to pay for the following month's coverage. So again, if you enroll during the pre-enrollment period, your premium amount will be based on your actual level of coverage. So your election for family or single coverage, depending on your family status. If you choose to waive, okay, during the pre-enrollment period, then no premiums will be deducted from you. And then if you have not yet enrolled or waived coverage by October 1st, you will begin paying family premiums until you complete the enrollment, or are then defaulted to single coverage after the end of the enrollment period. So what's going to happen is on September 16th, you will get an email from the union to remind you that the pre-enrollment period has opened. So please, again, watch your email inbox, check your spam or junk mail for any email notifications as well from HEB Manitoba. And we strongly encourage you to complete the enrollment process during the pre-enrollment window, okay, September 16th to 30th, so you can take advantage of the supports that will be there, including computer access that's going to be made available to you during that time. All right, so what are these resources and supports? Where can you go to get help? So I know I've covered a lot of information here today. I'm sure you've got your own questions. We will have a phone line, contact centers available to you to ask questions. So between September 16th to September 29th, okay, home care and mental health proctors, community staff can call Provincial HR Shared Services. The business hours is there Monday to Friday, 8:30 to 4, as well as a phone number and a toll-free number as well. And then starting October 1st, we ask that you direct your calls to the HEB Manitoba Contact Center. And their business hours, same Monday to Friday, 8:30 to 4. And you can see their phone number and toll-free number there on the screen as well. HEB Manitoba representatives will also join Provincial HR Shared Services on site at 3 of our larger locations to answer questions and help with enrollment. At these sites, computers will be made available for you to complete either your registration or your enrollment PHRSS will also be on site at selected pop-up locations where a PHRSS rep will be available to answer questions and help with enrollment as well if you're unable to complete it on your own. So these locations will be shared via email later in the week. Okay, resource coordinators, resource managers, and HR will also be available to you to provide assistance around enrollment and the registration process. Okay, so in terms of resources, I know we've got a lot of information we're sharing with you. You can access a copy of this presentation. It will be shared with your union, who's going to make it available to all members. Again, we strongly encourage you to visit HEB Manitoba's website and review their brochures. I'm going to open up to the temporary web page that HEB has created solely for the home care transition. So this is going to be an excellent place to go back to and review all of the information we've shared with you so far. On my screen here, you'll see both the URL address to that page as well as a QR code, and that QR code will take you straight to the home care transition page as well. Okay, so let's go here. All right, so that home care transition page, it looks like this. So unique to this transition. Everything you need to know and what we've shared with you so far is all included here. Direct links to the plan brochures for all of the plans. So full descriptions here of eligible expenses, for example, services that are covered, maximum amounts. FAQ will be here. Okay, we ask that you check back regularly because we will update or will update the FAQs as information becomes available. The benefits comparison information here, as well as the same transition timeline and a few more details in there that is all summarized here for you. So an excellent place to go back to check, to sum up everything that we've gone over today. Okay. So that concludes our employer presentation. We are now going to look to answer some questions that have come forward. So I'll throw it back to Shannon and Anna. Okay.
Thank you, Mignon. Okay, so we've gotten quite a few questions come in here, which is great. So I'm going to go through some of them. There's been a lot of questions coming in regards to pension. So there is a lot of information shared in the website. Sorry, one second, Mignon, can you keep that screen up? I want to just show you where you're going to find that information. So Mignon had showed this screen. So when you want to find the information, there's that frequently asked questions tab there. There's a lot of information shared there and answers to the questions that you've been asking. So I do recommend that you go in there and take a look, but I will answer. The pension questions that have been brought forward is, am I able to transfer my current pension into the HEB pension? So short, yes. If you're eligible, you can use the commuted value of your home care defined contribution pension funds to purchase service in the HEB Manitoba plan. So this would be called a commuted value transfer. To be eligible to do this, for this transfer, you need to enroll in the plan by November 30th of 2025. And then you'd need to start making contributions into the HEB pension plan starting October 1st of 2025. And again, there's more information in the frequently asked questions on that. The pension will not transfer automatically. You will have to initiate those inquiries, and you would have to initiate that with HEB Manitoba. The next question, does HEB provide the ability to continue insurance coverage beyond retirement, and what are those details? So you'd need to connect with HEB Manitoba after September 16th to inquire about any retirement benefits that are available to you post-retirement. Sorry, I've got to go through all these other pension questions that are here. How many sick hours can I take at a time? So the paid sick time is earned and banked at 1.25 days per month for full-time employees, and then it's prorated for part-time based on hours worked. So you can utilize that bank for the time off that you are sick, as long as you have the hours in your sick bank to use. During the registration process, when you're registering for your HEB Manitoba account, if you run into any issues with the registration process and you're confident that you've placed the spelling of your name correctly, your date of birth correctly, the social insurance numbers, if you've done all that correctly and you have tried a few times and you are unsuccessful in registering, then you will need to ensure that your employer as well as HEB Manitoba has the correct information on file for you. If you're entering your birth year as 1980 and your employer or HEB has it as 1985, that would be the issue. So there is going to be a data mismatch, and we need to confirm that data for you to be able to successfully register. When registering, can you use personal email? Yes, personal email is recommended. I'm currently on a leave of absence. Can I enroll? If you're currently on a leave of absence, then you will need to enroll when you fully return back to work. You can register for the portal today, but you cannot enroll into the plans until you fully return back to work. Can we use receipts from 2024 towards the health spending account? No, you would only be able to use eligible expenses incurred in the 2025 year for reimbursement. Are we out of the Canada Life Plan for benefits? Yes, effective October 1st, you will be in the HEB Manitoba benefit plans. If you are currently using the EAP program today, that will continue. All employees today have EAP, casual, full-time, part-time, all have an EAP plan and program. So that will remain in effect and it will transfer over. So you can continue to use your existing EAP program if you are currently utilizing the plan and program. If you're currently on a graduated return to work program, then you would maintain being on that program right now with Canada Life. And once you fully return back to work, then that is when you would be eligible to transfer over to the HEB plans. When you're eligible to transfer over to the HEB plans, this is for anyone on a leave of absence or a third-party supported graduated return to work program, you will, once you return back to work at full hours and full duties, you'll receive an email from HEB Manitoba at that time inviting you to enroll into the program. Okay, um, I think we're doing okay here. I think I'm answering most of them. Are we good for time or? Okay. Okay, we do have quite a bit of extra questions here, but we are running out of time. So I'll try to go through a couple more here. If I go for basic dental services now, can I add other coverage later? So once you enroll in dental, you get all of the dental benefits that are available under the coverage plan. So I encourage you to go into the HEB Manitoba site, and then you can go under the health, under the frequently asked questions for the health and dental. And there is a link there that says the plan brochures. You can click on that link for the plan brochures and it'll let you know all of the coverage details for all of the plans that are available. Okay. Okay. So I'm going to have Mignon open up the oh no, actually we are there right now. So Mignon, if you can just open, so if you can see this link right here, see the plan brochure details, because we are getting a lot of questions that are coming in regards to what do I get? What plans do I have? What's the coverage details of that? How do I get this information? This link right here is going to take you there. So if you click on the C plan brochure, it's going to bring up this here. This gives you all of the brochures, understanding your healthcare, dental, health spending account, your pension plan, your disability, life insurance. We have a lot of pension and benefit questions regarding retirees, what's going to happen there, employee assistance plan. And then there's guides below that in regards to all of the benefits that are available to you. So we understand that we're sharing a lot of information with you today, but we have tried to ensure that you have all of the information that you need to understand what you are going to be getting. These benefits are exciting. There's a lot of services being offered. So we do encourage you to click on this link. It's designed specifically for the CUPE group moving over onto the HEB Manitoba benefit plans. So you'll have all your information here. And if you have any further questions, we're keeping it open. We have a lot of resources, like Mignon had said, that are available to answer those questions and for you to obtain the information that you need. What we really wanted to get out of today is making sure that you understood the benefits that are being made available to you, where you can go and find this information. So we've showed you the site. Please write it down if you haven't already. Write down the site of the resources that are available. Take some time, navigate through, try to familiarize yourself with the information. And if you can, please log in, get that registration completed. You don't have to wait till the 16th to do that. You could do that right now. If you have any mismatch or you're not able to register, please call the employer, call HEB Manitoba, get that data cleaned up to make sure that you can register. And come September 16th, watch for that email and you'll be able to complete your enrollments online. Thank you all very much. Shannon.
Thanks, Anna. Yes, we've gone over time here, and the questions that are coming in have either already been answered or are available in the FAQ that we shared. And I will also say that there will be a recording of this presentation that will be posted on the CUPE websites and available for everyone to go and view it in your own time. But again, don't forget about the FAQ because a lot of the questions have been answered in the employer presentation already and in that FAQ. So I just want to, we'll close it off now. And I want to thank everyone for taking time out of their busy schedules to be here with us tonight. We appreciate your patience. I know, as we said before, it's been a long time coming, but we're here now and we're very happy and excited for everyone to be able to move over to HEB. And that's been said many times tonight. So I think we will just end it there. But thank you also to all of the members who we're passionate about this issue and we're, asking the question, when is this happening? When is this happening? Because we've been able to use that, both the employer and CUPE, pardon me, have been able to use that to make this happen. And we know it's been a long time coming. So again, thank you all very much. Please have a great evening. And again, the recording will be posted, I'll say tomorrow. We'll be able to post it tomorrow. Have a good night, everyone.